As far as the lameness assessment itself goes, I will go in and I like to stand back and look at the horse. While I'm standing back and looking at the horse from all four sides, I'm asking you simple things like, how old is he? You know, what does he do? At what level is he? And this sort of thing. While I'm doing that, while I'm asking you those questions, I'm assessing conformation, because a good percentage of lamenesses are related to conformation defects. So once I've assessed his conformation, his condition, his attitude, you know, I'm watching you hold him, and I'm assessing whether he's a good-mannered, well-mannered horse, or whether he's a bit of a goof, you know, all those things. Then I will walk over closer to the horse, and I kind of do a general body exam, which is basically just putting my hand on the horse. I want to see whether he's tense or whether he's relaxed with strangers around, and that's along that line. And then my examination starts at the left nostril and goes right around to the right nostril. And as I go to each part around the horse, I'm looking at it. I'm looking at it for inflammation. I'm looking at it for pain associated with pressure. I'm looking in joints for effusion, which is excess fluid in the joint. And I'm doing, you know, simple flexion tests to look for pain on flexion. I'm also running my fingers down arteries to feel for strong pulses, because that'll tell me a lot. And in making that round, I can usually determine where I should be looking for the lameness, okay? So if I make the whole round around the horse, and I've determined what I should be looking at, or I haven't determined what I should be looking at, then I will ask you to jog them off in a straight line. Now this is where 90% of the people have a lot of trouble, because what's a straight line? And because I want to see a horse normally trotting away in a straight line will put his feet in certain spots. And if he doesn't put his feet in those spots, then that could indicate a problem. And if you're going down in a zigzag line like this, then he doesn't. The same with folding them. I mean, a horse, when he's going away in a straight line, should fold them up like this. But if you're going like this, I can't tell for sure how he's folding them. The other thing is when you get to the end, and I say that's far enough, generally people turn the horse and walk around the outside. That's fine, okay? But I might ask you to do it again and turn the horse the other way, because I want to see how the horse turns on both front legs. I assess horses on soft footing and firm footing, okay? For instance, I had one last week, mostly for feet problems. Foot problems tend to show up less on soft surfaces and show up more on hard surfaces, just because same as you are. You know, you walk on a carpet, your legs don't get sore. You walk on concrete all day, your feet get sore. And that's basically it. But I do want to see that there's a difference, if there's a difference. And usually if a horse shows a mild lameness on a soft surface, then on a hard surface they'll show. Okay, flexion test essentially means you bend the joint normally and you hold it for a given period of time, and then you trot the horse off, okay? What that does is basically, if that joint is sore, then that increases the soreness in the joint and the horse goes off lame. So that's really all it does. If you've got an arthritic joint, or you've got a joint that's been sprained, or the ligaments around the joint are sore, by flexing it, you've increased the pain in the joint, and they'll walk off. And then you assess how many steps did they walk off lame. Okay, so is it 4 steps? Is it 10 steps? Is it 15 steps? And that, in a way, gives you the degree of lameness that you might be working with. I want to see a nice, even At the end of the thing, I want a nice controlled lunge. Nice horse out there just trotting along, walking or trotting. I don't do much diagnosis at the canter, it's just the walk or the trot. And as they go around, they have to be nice and quiet because I'm looking at extension, I'm looking at flexion, and I'm also looking at their weight-bearing phase. The other thing I look at is that second before the horse's foot hits the ground, whether they hesitate or they hit the ground. A horse with we'll say a foot abscess, when he puts the foot out, believe it or not, that second before he hits the ground, that millisecond before he hits the ground, he will hesitate because he knows it's going to hurt as soon as he hits the ground. And you can see that. I'm also I look for stride because a rider might complain about a horse being uneven gait, but they really can't see a lameness. It's because they're sore in both front legs. All you see there is a shortened stride. I will ask you to go both ways, or else if you're just jogging them to turn both ways, because there are two types of lamenesses, weight-bearing lamenesses and swinging lamenesses. Weight-bearing lamenesses means it hurts when you put the weight on it. Swinging lamenesses means it hurts when you swing it. So if, for instance, you have bruised your muscle in your leg, it usually doesn't hurt to stand on it, but when you go to move it, it hurts. If you've sprained your ankle, it hurts to stand on it, but when you move it, it doesn't. So it's the same with a horse. If you've got a foot abscess, it doesn't hurt him to lift it off the ground, but when he puts weight on it, it hurts. And so on a circle, the horse bears more weight on the inside leg. So if he's lame on we'll say the inside leg going clockwise, then I'll ask you to reverse it and go counterclockwise. If it's a weight-bearing lameness, he should be a little sounder going counterclockwise. If it's a swinging lameness, then going clockwise, he'll be lame on the outside leg. He'll show a lameness. But when you go counterclockwise, he'll be sound. I look for shoe wear, because that tells me how the horse, or footwear, because that tells me how the horse has been landing for some period of time. If this is a chronic lameness, if it's an acute, it won't. But chronic, on racehorses, it's all important. You look at shoe wear, because, unless they just put shoes on yesterday. So then I asked them, was this horse just shod? Because a lot of lameness have to do with foot abscesses. And if he's just been shod 3 or 4 days ago and he's lame, he's likely got a high nail or something that's causing it. So all these questions and how they carry themselves lead you towards a diagnosis. The palpation will give you an idea what area you're looking at, and then the movement will give you an idea how involved that area is.